everybody, this is Shri and we are from Sis Learnings, and today we're going to go over the hospital, some medical vocabulary, and different doctors and what they do. So let's begin. Oh Leah, what's happening? Are you feeling alright? You're so dull.
Oh, I'm sick and I don't know any place to go.
Oh, did you go to the hospital?
What's a hospital?
A hospital is an institution providing medical and surgical care for sick or injured people. And it's also where you can see a nurse or a doctor.
Ooh. Well, what's a nurse?
A nurse is a special caregiver for a patient, and they help manage physical needs and prevent illness. And the nurse will also check your vitals, such as your temperature, your blood pressure, and they'll see if you have a fever.
Ooh.
And then a doctor will come in, and they'll analyze all the data, and they'll write some medicines or prescriptions for what you need.
Ooh, well, what's medicines?
The medicine helps you feel better if you get sick or something. So a pharmacy is where you can get medicines, because it's where medical drugs are dispensed and sold.
Ooh. Thank you for telling me about the hospital. Now I think I gotta go to the hospital now because I'm sick, I just told you.
Alright, bye!
Bye everyone!
Hello everybody, now we're at the hospital. So let's talk about all the doctors and what they do. So a children doctor is called a pediatrician. My sister is 6. So a pediatrician, she has to go to the pediatrician because a pediatrician is an infant, a child, or a kid doctor. Then we have the brain. So if you have any brain problems, then you have to go to the neurologist. So a neurologist focuses mainly on the brain and the spinal cord. So if you have any issues or problems with your brain, then you need to visit the neurologist. Then we have an eye doctor, which is called an ophthalmologist. If you have a vision problem or any other eye-related problem, then you need to consult an ophthalmologist. Then we have a teeth. So a teeth doctor is called a dentist. So if you have a toothache, a cavity, or any other problems with your teeth, then you have to go to the dentist. Then we have the nose, the ear, and the throat. So those are all, if you mix those together, then that's an ENT doctor, which is also known as the otolaryngologist. So if you have a sore throat or if you can't hear properly, you have to go to the otolaryngologist. Then we have our lungs. So a lung doctor is called a pulmonologist. So if you have breathing problems or you can't breathe well, you have to go to the pulmonologist. And then we have our heart. So if you have any heart issues, go to the cardiologist because a cardiologist is a heart doctor. Then we have our kidneys, which is a nephrologist doctor. Like our kidneys, the nephrologist is a kidney doctor. Then we have our stomach. So a stomach doctor is called a gastroenterologist. So if you have any digestion problems, go to the gastroenterologist. Then we have our bones, which is an orthopedic. So if you bone doctor is called an orthopedic. So if you have any bone problems or if you have a knee ache, you can go to the orthopedic. Then we have our blood. So a blood doctor is called a hematologist. Then we have a urologist, which is a doctor that focuses on the urinary system. And if you have any common problems such as a cold, a cough, or a fever, you have to go to the general physician. And then we have old people. So if you're old, then you can go to the geriatrician, which is an old people doctor. And if you have cancer or something, a cancer doctor is called an oncologist. And a gynecologist is a woman's health doctor. A psychiatrist is a mental health doctor. And a surgeon is a doctor that does surgery. There, now we're going to learn about some medical vocabulary. So let's start with the hospital. So a hospital is an institution providing medical and surgical treatment for sick or injured people. Then we have a pharmacy, which is a store where medicinal drugs are dispensed and sold, such as CVS or Walgreens or any other pharmacy. Then we have a diagnostic center, which is used for blood tests, x-rays, to determine a person's condition, such as some diagnostic centers are Quest and LabCorp. Then we have a physiotherapist, which is a therapist who treats physical illness or injuries with exercise. Then we have a nurse, which is a caregiver for a patient, and they help manage physical needs and prevent illness. There are other clinical staff such as a PA and an MA. A PA is a physician assistant, and an MA is a medical assistant. There's also something called first aid. First aid is an emergency care given immediately to an injured person. There's also an ambulance, which is a vehicle specially equipped for taking sick or injured people to the hospital. And there's important information. It is very important to call your emergency number in an emergency situation like accidents or severe injuries. Bye everybody, I hope you learned something new today. If you like this video, please subscribe. And if you have any questions, you can leave it in the comments below. Goodbye!